A clinical practice update by Jensen, published in the British Medical Journal, looked at the diagnosis and treatment of sciatica. And while this article wasn't a randomized controlled trial or a systematic review, I still found that this article was valuable. And before discussing the article, I actually wanted to discuss why I actually found that this article was so valuable. And the reason is because in healthcare, it's hard to actually stay current with the research. There's so much research that's consistently being published, and there's just not that many providers overall that actually consistently read the research, which is why Adam Meekins started this Read a Paper a Day challenge for January to help kind of get healthcare providers to consistently read the research. And the reason why this article was so fascinating to me is because it was very straightforward and easy to read. And so one of the problems that we typically hear from healthcare providers is that reading research is time consuming and that it can be difficult to actually translate the research into clinical practice. And this article specifically helps to kind of overcome some of those barriers. So when we look at scientific research as a whole, it's typically very dense, which is why it takes so long to read, because one, you have to consume the information that's actually being presented, but then also analyze it to make sure that the data matches what is being said in the article. And so when we look at this article that is kind of just an overview of sciatica, it kind of stripped away a lot of that information, so it was very easy to consume. It looked at what is the current theory of sciatica and kind of just gave you the basics that you need that is current with the evidence. Same thing with the diagnosis. What should we do for actionable steps? These are the examination findings that you would look for sciatica. And then for treatment, it just broke it down into basically conservative care of what we should try first. Are there any medications that should be used, and then looking at injections and surgery as well. And it kind of just gave you a nice little flow of what the current evidence is in a nice digestible way. And one thing that I thought was really cool about this article that I actually haven't seen in other research articles is that at the very end of the article they had a little box and it had two questions in it, and the title of the box was Education into Clinical Practice. And the idea is that you would answer these two questions and it would help kind of take that information that you just read from the article and be able to actually use it in clinical practice. And so, for example, one of the questions is that if you had a patient who's just diagnosed with sciatica, how would you discuss why they don't need an MRI? And that's obviously helpful because that's a scenario that you're probably going to deal with in clinical practice. If someone is diagnosed with sciatica, they're going to ask, well, do I need advanced imaging? And so being able to actually take the information from the research article and then formulate a response that you're going to use. As for the information actually presented in the article, like I mentioned before, I like that the way that it was set up because it was very straightforward in how we actually implement this into clinical practice. So for example, they looked at risk factors and they mentioned smoking, obesity, as well as heavy labor. And so those are very easy questions for us to ask when somebody is presenting with sciatica is, are you a smoker? Looking at strategies to deal with obesity, and then also we could touch base on exercise as well as lifting mechanics to maybe help them deal with the aspects of their job or if they just lift a lot of heavy stuff. And so the way that that's presented is very straightforward. They didn't talk about odds ratios, they didn't talk about correlations, which I understand as a whole is important, but if we're looking at just trying to implement the research into clinical practice, I thought that this approach was very helpful. And then the same thing with diagnosis. They discussed that the diagnosis of sciatica is mainly clinical. There's no blood test, imaging typically isn't recommended, and so the presentation of sciatica is typically low back pain, but mainly pain down the leg, and for sciatica it's pain below the knee and into the foot. And so they also had given a couple of orthopedic tests, such as like the straight leg raise, and showed or reminded people how to actually perform it. And so it was very succinct, which is helpful when somebody presents with sciatica, of just kind of going, well, these are the couple of things that are most supported by the research, this is what I should do. And for the treatment recommendations, it was that same straightforward approach. And so they recommended for conservative care first, and that typically entails exercise and manual therapy. And then they looked at medications where they said that, well, overall, medications actually haven't been shown to be that beneficial for the treatment of sciatica. And then if they don't respond to conservative care, so exercise and manual therapy, then an injection or surgery can be used, but typically we need 12 weeks of conservative therapy before we should actually look at either an injection or surgery.